So today we're going to talk about two health issues that are super common, but here's the good news. They are highly manageable. We're diving into high cholesterol and asthma. Let's get right into how you can take control. Think about that for a second. Are you really listening? Because, a condition like high cholesterol can be completely silent, giving you no hints at all, while something like asthma might be sending signals that are all too easy to just brush off. This whole explainer is about tuning into those signals and knowing what to do next. Okay, so first things first, before we can even start talking about managing these conditions, we need to know exactly what we're dealing with. Let's break down what's really going on inside your body with high cholesterol and asthma. Trust me, understanding the why is the first step to taking action that actually works. So you can see right away, these two look totally different, right? On one side, you've got this silent problem with fat in your blood. On the other, a very noticeable inflammation in your airways that makes it hard to breathe. So what's the common thread? Well, they both demand our attention if we want to avoid much bigger problems down the line. The word that should really jump out at you here is silent. That's what makes high cholesterol so tricky. It's a hidden risk because you can feel perfectly fine while it's developing. All that excess fat can start building up as plaque inside your arteries, which kind of narrows the highway for your blood flow. And that's exactly why this is so important. The only way you can know for sure what your levels are is through a simple blood test. So if it's hiding, where does it come from? Well, you can see here it's a mix of things. Some of it is just the luck of the draw, your genetics. But a lot of these other things, diet, exercise, smoking, those are lifestyle choices. And that's actually great news. It means for so many of us, getting a handle on this is totally within our power. Okay, let's switch gears and talk about asthma. This is a chronic condition, which just means it's a long-term thing. Basically, the airways in your lungs get inflamed and swollen, and that makes them narrower, which, you guessed it, makes it tough to breathe. But here's the most important part. With the right treatment, people with asthma can, and absolutely do, live completely normal, symptom-free lives. And this really gets to the heart of managing asthma. It's all about becoming a bit of a detective and figuring out your personal triggers. I mean, what sets off symptoms for one person, like pollen in the air, might be completely different for someone else who's triggered by, say, stress or a tough workout. All right, so we've got a handle on what these conditions are. Now for the really important part, spotting the warning signs. How do you know when it's time to stop wondering and actually call a doctor? So, since high cholesterol itself doesn't send out an alarm, you have to look for clues. If heart disease or stroke runs in your family, or if you're dealing with things like weird fatigue or chest pain that you can't explain, that is a massive signal from your body that you shouldn't wait to get those levels checked. With asthma, on the other hand, the signs are usually a lot more obvious. Things like a cough that just won't quit, wheezing, or that feeling of tightness in your chest. And here's a big one. If you find yourself reaching for that rescue inhaler more than twice a week, that's a clear sign your current plan isn't cutting it, and it's time for a chat with your doctor. Okay, so we've talked about the problems and the signs that tell us something's up. Now for the best part, the most empowering part, the solution. Let's look at what a modern management plan really looks like. This is where you take back the steering wheel. Look, this isn't just about getting a prescription and being sent on your way. Not at all. A good plan is built on these 6 pillars. It's a whole strategy, a partnership between you and your doctor. It starts with getting the right tests, but it also includes lifestyle coaching, identifying triggers, and regular follow-ups. The whole point isn't just to treat a condition, it's to empower you to manage your health every single day. Okay, let's tackle a question I know a lot of you are probably thinking about. Can you really get high cholesterol under control without having to take medication every day? It's a fantastic question, so let's get a straight answer. And the answer is sometimes yes. For milder cases, if you work with your doctor and go all in on changing your diet, getting consistent exercise, and managing your weight, those changes can absolutely be enough to get your numbers back where they need to be. And what about asthma? It's a similar kind of question people always wonder about. Is this something that you can ever just be done with? So this is a really, really important distinction to make. It's about cure versus control. And while there isn't a cure for asthma just yet, it is 100% a condition that can be well controlled. With the right plan, it should not stop you from doing anything you want to do. So let's bring it all home and focus on what this is really all about. This isn't just about watching numbers on a lab report or dodging triggers. It's about something so much bigger, fundamentally improving your quality of life. It's about breathing easier and living a longer, healthier, fuller life.
I love this quote because it just nails it. It's a message of total hope and empowerment. These conditions do not have to be in the driver's seat. With consistency and by working together with your doctor, you can absolutely get them under control. It is achievable. And that's what I want to leave you with today. A question, just for you. It all starts with one small step. You don't have to overhaul your entire life tomorrow. Maybe it's just scheduling that doctor's appointment you've been putting off. Maybe it's taking a 10-minute walk after dinner tonight. So, what's that one healthy choice you can make today to start taking control?